Now let's go on. We're gonna go on to the next lecture. And that next lecture was given by a physician that I have great admiration for, and that's Dr. Suzan Obagi. So Dr. Suzan Obagi was our keynote speaker at the California Academy of Cosmetic Surgery 23rd annual meeting, and I've learned from Dr. Obagi attending many national meetings, and she's really big on facial fat grafting, which we're going to talk about in another show that I was actually honored to give a talk while she was there about facial fat grafting. But the particular lecture that I wanted to discuss that Dr. Obagi presented was entitled Skincare and Lasers. Skincare and Lasers, okay. So this, I think, is a really important discussion that we can have on our show today, because this can save you money, okay? This can save, everybody wants to save money nowadays. So we all walk in and we think we want the big guns, right? And especially guys, give me this, okay? I want the laser, I want this done, and we think we're gonna do that one and done thing, which is, there's not too many things that are one and done in the world, okay? But, we come in and I want the laser, okay? And Dr. Obagi very astutely pointed out that it's combination therapy that's gonna give us our best result, and that we need to prepare the skin. We need to prepare the skin if we are going to get the best results with the laser, with microneedling, even with surgery. So she kind of reviewed, in my opinion, she reviewed very nicely, very succinct. She reviewed what we should do, even if we're going to go ahead and have a laser treatment for our skin. So number one is cleansing. And remember, she's a cosmetic dermatologist. Her father was actually the one who developed the Obagi skincare line. Dr. Suzan Obagi, who I was listening to, is now the medical director. But she also is an associate professor at the University of Pittsburgh. She was from San Diego originally, and she moved with her family out to Pittsburgh, her husband and her children. And that's where she's been for her professional career. So she was very happy to come back home to San Diego to speak at our meeting. And so Dr. Obagi talked about cleansing the skin and how important that is. The daily pollutants, environmental injuries to our skin, that we need to wash our skin, and usually with a gentle cosmetic soap, okay, if you will, or cleanser instead of saying soap. That's going to help to get rid of the debris. By getting rid of the debris, we help to exfoliate some of the skin, but we also help to open up the skin so whatever other products that we use are able to penetrate and go to where they need to go. So one of the first things that she would recommend after washing your face would be to use an antioxidant. And so she believes that using an antioxidant helps to protect the skin and repair the damage from environmental forces as well as from aging. So antioxidants would be products such as vitamin C. So vitamin C we can take orally, and I'm a big proponent of oral vitamin C, but I'm not sure that what I take orally is getting out to the outermost portion of the skin. So really we need to supplement that benefit of vitamin C and the antioxidants with a vitamin C antioxidant serum. So that's going to be important. Another one that I really like that she mentioned was using niacinamide. Niacinamide is a vitamin B congener or compound, and what that does is it works very well. It not only is an antioxidant, but also works on our pigment. So if you have problems with pigmented skin, that can be very important in helping to decrease the pigment. And I personally use our cleanser, and I use our new, we call it Glass, okay? Dr. Tom's Glass serum, and what it does is help to create that glass skin that's been popularized, or maybe called the Korean glass skin. And I remember listening to a lecture, remember always the perpetual student of a Korean dermatologist talking about niacinamide and its benefits, and I started using it, and I have to say that I was very happy with the results of using the niacinamide on my skin. So those are two antioxidants you can use, vitamin C or the vitamin B compound called niacinamide, okay? And then she also mentioned probably one of the most important topicals that we can put on our skin is Retin A. Okay, so Retin A, here we go again, is a vitamin A compound, and it has been shown to help to increase cellular turnover, to be able to reverse some of the aging signs, and to minimize wrinkles. So Retin A, in my opinion, is your best bang for your dollar if you're going to use anything on your skin. And she always recommends, don't forget to treat under the eyes. And she had some great photos before and after of people in their aging, and they don't treat under their eyes, and the rest of their face looks pretty good, but right under their eyes, it doesn't look as good. So Retin A is important to use. If you have more sensitive skin, you can use retinols, which your body eventually converts over to Retin A. So Dr. Suzan Obagi, I'm going to give you some more information about her on our next show. Again, as I mentioned, I have great respect for her. She's a wonderful cosmetic dermatologist, and her talk about skincare and lasers was really enlightening to me. So I want to thank everybody for listening again to us on KSRO.